Hey everyone, Dr. Skylar Baku here, and in this video I want to talk about those childhood earaches. It doesn't get much more painful than that, and obviously I've been there, and I know a lot of your parents out there. You've dealt with a kid that's been crying, and you just want them to get some relief from these earaches and those ear infections. So typically what happens, right, is you end up going to the medical doctor. We just want some type of relief, so you get the required antibiotic and you start giving it to the child, and they're better in a few days, right? Until the next time. Okay, then you're back again at the doctor's office for another round of antibiotics, and it's this merry-go-round over and over. Every time you get an ear infection and more antibiotics. Okay, and so eventually maybe the medical doctor will refer you to an ear, nose, and throat doc. For some tubes to allow for the drainage behind the eardrum. And so if your child's in this cycle of misery, get them out of it. Okay, and here's a couple of ways how. Okay, so first, get the child off all dairy products. Okay, milk and cheese are mucus producers, which leads to snotty noses and sniffles. Okay, the snot ends up in the eustachian tubes and it plugs them up. Okay, so this leads to unequal air pressure, on the eardrum, and that's what causes some pain. Okay, additionally, mucus leads to a breeding ground for infection behind the eardrum, which means more pain. Okay, so getting your child off dairy products, might be enough just to get them off this cycle of constant ear infections. Okay, so traditional allergists say a 3-week trial of elimination should tell you a lot about that food substance. So for instance, you avoid dairy for 3 weeks. If it improves in 3 weeks, then you'll know. If it doesn't, then maybe it's not a problem. So if you're better after that 3 weeks, now you know that food's a problem, and that can go for any food. So whether you're avoiding gluten or corn or whatever it is, give it that 3-week trial. And if you're better in that 3-week trial, then you know that food was a problem. So if not, again, it's probably something else, and we could take a look at the next logical thing. So if the dairy elimination is not enough, there's a lot of natural supplements we can use that usually work super well as well. Things like IgA powder, things like magnesium. Okay, so IgA is really important and helpful for regulating the immune system. I use things like lauricidin, things like morinda. It's from the Hawaiian noni fruit. It's a major broad spectrum antimicrobial, so viruses, bacteria, fungus, parasites, all those things, and it's very safe for kids because it's just a whole food form. I also like to use high dose vitamin C, liquid liposomal vitamin C. Usually the kids like the liquid form. It's much easier to take as well, and you can put it in formula or whatever you need. Okay, so the magnesium is super helpful because it also helps to thin some of the mucus, and it lowers the inflammation from the infection as well. So I like to take a dose every hour until we start seeing loosening of the stool. That's when you've had a good enough amount of magnesium in the system, and then we can start backing off. Other than that, there's a lot of natural anti-inflammatories that we can look at. There's a lot of other antimicrobial supplements we look at, and I like to just test the individual patient so I can make sure that what I'm prescribing is exactly what that patient needs. Things also like iodine helps to thin the earwax. So finally, though, I often see these kids with these recurring earaches and ear problems and ear infections. They have problems in the upper neck of the spine, okay? Particularly that first cervical vertebra, occiput area, maybe the second cervical vertebra. The reason is the nerves in that area are the nerves that control the inner ear as well, okay? Or go to the inner ears, especially like the vagus nerve, okay? So getting them to a chiropractor for an evaluation, and perhaps an adjustment in the neck is often required, and it's often super helpful for breaking that recurring cycle. Okay, so I've seen it over and over, and we've seen some amazing success, and I know a lot of chiropractors all over the world have seen amazing success with ear infections and earaches with upper cervical adjustments for a long time. So again, if this is happening to you or your kid, please just consider getting them checked for by a chiropractor, and check for some of these supplements that'll help them to, again, break that cycle from getting these earaches and those ear infections over and over. So thanks so much for watching. I'm Dr. Skylar Baku with Baku Chiropractic and Functional Medicine. Our number is 720-998-7956.